I'll be going, okay. No, sorry. Hello. Are you guys able to hear me right now? Okay.
Yes.
Okay. So welcome to this live section today, and I'll be going over a quick startup presentation to welcome you all and introduce you to our program and various opportunities if you have not previously attended our shadowing sections. PHS is a student-led, minority-led, women-led nonprofit organization dedicated to helping prospective healthcare professionals gain access to educational resources no matter their demographic status, ability, or location is. So my name is Christian Jose and I'm from Texas at PH. I'm a team member at PHS, and thank you all for attending today, and let's get started. So we do have closed captioning for all our live sections to accommodate all students. This setting is accommodated on the bottom of our Zoom screen. And if you need assistance enabling the transcript, please direct message one of our team members. We are always looking for ways to be more inclusive and ensure our sections are accessible to everyone. So if you have any recommendations for how we can improve, you can email to us at info@phs.com. If you want to stay in the loop or follow us on social media. We are active on Instagram, TikTok, or sign up for the email list on our website to never miss a section. So since this is an international program, we want to know where you are zooming from. Drop it in the chat box. And I am from Texas, and we have some wonderful opportunities for you all as benefits of being a part of our team. Are you looking for a research experience? And did you drop the ball on applications this year? I'm excited to announce that PHS is launching a research program that will allow students to connect with pals. Okay, so there's a poll over here right now, and just poll about where you guys come from and which journey and which state, and are you new or anything over here in PHS? So speaking on the research, um, I'm excited to announce that the PHS is launching a research program that will allow students to connect with pals, which include principal investigators and researchers, etc. And as they conduct research in a philanthropia of topics, fields, and locations, this program is 100% remote, which means you have the power to connect with anyone online. Some of the subjects of the research this program offers includes diversity, medical education, student interest, health professional school matriculation, and mental and behavioral health. Students will access to professional connections through seminars, which are one-on-one meetings, and have graduate mentors assist them with their projects. With that being said, we are offering the opportunity for students to become mentors in these research programs. Applicants are strongly encouraged to process the following strengths: data entry, data analysis, academic writing, collaborating with students, presenting data or concepts, and more. If you are interested in a research program or in becoming a mentor, please scan the QR code. Please scan the QR code on the screen and apply. For the month of September, PHS is excited to announce that we are hosting a bingo board social media event where you will be able to fill up a bingo board with each month having a specified dollar amount. To participate, all you need to do is post on this on your social media platforms and get a group of friends to help you fill up the board. Check out our blog post for more details. Additionally, we have partnered with Krispy Kreme for you to purchase 1 dozen of donuts to enjoy with your loved ones. With a donation of $10, you will be able to receive a treat while also helping out as PHS. More information and instruction can be found by clicking the link in the chat. Lastly, it is a perfect time to exercise outdoors. With PHS new pledge drive event, for this event, you will essentially be able to work out and help raise money for an excellent and healthy cause. For every $5 donated to you, you'll be required to exercise for 1 hour. For more information, please visit our website underneath the blog section. So another program, Mask for Mask, is an exciting women-led organization that donates 4 masks for every 4 masks sold. These go to the people in need during the COVID pandemic, those in homeless community, healthcare workers without proper PPE, and others who are struggling to stay safe. With our discount code PHS15, you can get 15% of your order off. If you buy through this method, PHS will also get 10% of the proceeds, which is amazing because we are a non-profit organization that solely works to support our community. If you want to play a bigger part in supporting PHS, we would love for you to join our network of student volunteers and team members. You can apply to be a part of our administrative team and lead students in various projects and initiatives with professional outreach, brand writing, and more. We understand that as a PH student, you may not have, as pre-head student, you may not have in the enough time, so we offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would love to have you be a part of our team and contribute to your own unique perspective. Along the lines of that, PHS is taking a great pleasure to announce the newly available PHS leadership positions for the year 2021 to 2022 academic year. Our organization welcomes students of all majors, education levels, demographics, and professional interests who are eager to make a difference in the field of healthcare. Students can take on leadership roles remotely and apply to any of the following positions listed on the screen. As a student-led organization, members of our team take on various roles that encompass uh, project management, volunteer coordination, and collaboration among following players. Additionally, each of these chief positions will be accompanied by possible assistant chiefs. Lastly, keep in mind that students are given the flexibility to create their own schedules. Our members are expected to commit a minimum of 5 to 8 hours on a weekly basis. So if you want to get experience in leadership or further your skills, please click on the link sent in the chat. If you have any questions, feel free to message one of our board members and we will assist you. If you are a high school student and want to get involved, we have started a program called HTP, High School Training for PHs, which allows you to connect with college pre-health programs, get involved in fundraising for PHs, and organize resources for every high school students interested in medical school. We want to recognize the hard work for all of our students in this program. So if you are interested in getting published, you can submit essays, reflection, research papers, and reviews to our editor and chief through the link dropped in the chat to have your work on our website. This will look great on CVs, applications, resumes, etc. So take advantage of this. Part of our mission at PHS is to promote diversity. And in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a series of patient experiences, a COVID-19 roundtable, and an international student forum. If you have a mentor, professor, or a professional that have inspired you, think, think could contribute to the conversations, nominate them using the link in the chat. If you can, if you can, we humbly ask that you donate to our program. As you know, PHS is completely student-led, and we are running around the clock to keep this free and accessible to all. Unfortunately, Zoom and every website and other websites are not free, so any contribution you can give would be greatly appreciated. If you are not financially able, we request you to send this link to someone you think can help us. Throughout this live section, today, we encourage you to drop any questions you have for the speaker. Our team members will be making note of these and will ask it uh, after the presenter has done her speech. Taking good notes as our professional is going over this presentation, as there will be a chance to take a post-shadowing assessment to verify your virtual shadowing hours. Also note that our professional is not going to have a presentation and she's going to have say about her lecture and her experience in uh, during the medical school. So there's not going to be a presentation. So please do take an extra concentration to take to dock out important points that she says, because we don't have a presentation exactly. Lastly, if you can, we request you to turn on cameras. This is no by means of an obligation, and we are respectful of different circumstances, but it do feels to be closer in a time where social distancing is mandatory. We also request you to mute as our professional has the complete and the full attention from the audience. I appreciate you for listening, and now I would like to welcome the professional and thank you so much for joining us today. You may share your screen whenever you're ready, ma'am.
Oh, me share my screen?
Mhm. Oh yeah.
I don't have any
No.
screen to share because I don't have a presentation. I didn't get any emails. Like when I originally got the email and asked to do this, I thought it was just I was going to talk. So anyways, thanks for having me. I think it's really awesome that you do this type of thing, especially like with Zoom as a platform. When I was in medical school, like it was a lot of live sessions that we did for the pre-health students, but I think this is awesome that you're doing this on your own time. So basically they asked me to talk about my journey into medicine. So I'm an MD. I practice in Utah at Brigham Young University. I actually went to the Brigham Young University on an academic scholarship for my first year. And I didn't feel comfortable there. I'm Native Hawaiian, and I just kind of needed to be in an environment where I had people who looked like me and kind of had the same goals. So I ended up leaving after my first year, and I went to Brigham Young University in Hawaii, where I'm originally from. And I majored in mathematics, and I got a minor in biochemistry, and I worked at the Polynesian Cultural Center as a dancer and shared my culture, and I loved it. And then I went on a mission from my church to New Zealand for a year and a half and came back and finished my degree. And then I went to University of Utah for medical school for 4 years. And then I did residency. I chose as my specialty. I went in always intending to be a pediatrician, but I found that I really loved medicine. Actually, I should go back to medical school. I had the person who asked me to do this she was the director for diversity and community outreach. And while I was there at medical school, we did a lot of programs for the underserved and for people of color. And it was awesome. So the person that headed up those programs was Sunny Nakai, and she's actually Dr. Nakai is I believe she's the Dean of Admissions at University of California, Riverside for their medical school, which they didn't have a medical school when I was going to school. But so she's the director of admissions there, and she actually helped me. She approached me once when I was in medical school and told me like, hey, I think you should apply for this scholarship. And I remember thinking like, oh, I'm not gonna get that scholarship, but it was for the American Medical Association for a minority scholar. So I applied and I got it. It was a $10,000 scholarship. And if it wasn't for her, I wouldn't have even tried. And so, along the way, if there's any way that you can help someone to believe in themselves, I encourage you to do that. And I appreciate that you're doing this program for others, because I think it offers them opportunities to see others who look like them go into medicine and helps them to believe in themselves as well. So I just want to thank Dr. Nakai for believing in me and helping me, because that $10,000 scholarship helped a lot. My medical school when I started was $17,000 a year. And when I finished, it was $28,000 a year. And now it's over $30,000 up at my school. But when I finished, I had $107,000 in debt, which when I did my exit interview, they said like, are you graduating? And I was like, yeah. They're like, well, you have significantly less debt than a lot of your classmates. And I'm like, yeah, $10,000 scholarship with interest that would have accrued over 4 years was really helpful. So, and then also just all the opportunities to serve people of color while I was there in medical school was amazing. There are a lot of Pacific Islanders like me in Utah. And so there were programs that targeted the schools where they went. And I remember several times having students tell me like, hey, I've never seen a Pacific Islander in medicine. And so, it's important to be visible as a person of color when you go into the health professions. It helps people to open up. It helps people to like feel comfortable because you understand their values and their culture. And people of color are more likely to serve in the underserved communities as well. So let's see. Someone's asking some questions. Okay, I'll just finish. So after medical school, I found that I did still love pediatrics, but I also loved medicine. So internal medicine, it's basically everything that you learn in medical school. And I was like, I won't get to do all this cardiac stuff if I go into peds. So I did a double residency in both internal medicine and pediatrics, and I loved it. I love being in the ICU, probably especially, but I was pretty done after 4 years of residency and didn't want to do another 3 years of residency. So after I was done, I became a hospitalist, a pediatric hospitalist specifically. So what that means is I took care of sick children in the hospital until they're well enough to go home. And so I did that for the past I did that for 8 years. And then for the past year and a half, I've been working at a university. And the reason for the change was not because I didn't love my job. I absolutely do. And I still actually work at the hospital occasionally and help out. But my mind and my body were having a hard time switching back and forth between working days and nights. So most hospitalists, we work for 7 days straight, 12-hour shifts. So I work for 84 hours in a week. And then I was off for a week. And then I'd switch to night shift. If I worked days, then the next time I worked, I'd work 7 nights in a row, and then I'd be off for a week. And then I work 7 days in a row, back and forth. So when you're considering the specialty you want to go into, just think about the type of schedule you're going to have and how it might affect your body. My big thing was I just couldn't sleep anymore. I had a hard time sleeping because my brain was always confused about if it was day or night. So I've been working for the past year and a half at Brigham Young University at their student health clinic, and I enjoy it. I get to see pediatrics and I see medicine. I see the employees and staff, I see students, and I see their children. So it's been interesting because as a lot of you know, probably Brigham University is predominantly Caucasian student based. And so there's another doctor who's actually married to my cousin. She's also a person of color. She's Filipina. And so to have two female physicians of color is pretty rare in the county that we live in, and especially at BYU. So it's nice because I actually have a group of pre-meds that are Pacific Islanders. There's 5 or 6 of them that I meet with regularly, and it gives me joy because at my last job in the hospital, I was in charge of resident and medical student education, and I really miss teaching. Right now I'm working with I have a nurse practitioner student working with me, so that's really fun. But I love to see people who are passionate about medicine and see their eyes just go bright when they see something exciting, and just know that they understand what it feels like to love medicine. So we'll go ahead and answer these questions. How hard do you rate medical school from a 1 to 10? So academically, I would say it was probably, compared to my math degree, I would say it was maybe a 7. I think my math degree was actually harder, but physically it was hard. And I guess mentally too, emotionally, I would say, because I don't know if you understand the format of medical school, but the first 2 years are like books. So you basically, you're in class for maybe 6 hours a day. Maybe you have anatomy lab in the afternoon during your first year. And then there's some other classes that you take, and the rest of the day you study. And I'm just going to say right now, I always made sure I exercised every day and I slept for 8 hours a night. And I think that's really important for you to do, to start as a habit now. Your mind can't work well if you're not getting enough sleep and you're not getting enough exercise, you're not getting outside. So make sure you do that. So back to, let's see. So it wasn't really hard intellectually, I don't think. I think it was more hard during the 3rd and 4th year when you start going and having a resident schedule. So 3rd and 4th year, you do rotations. And, you do pediatrics, you do family medicine, you do surgery, you do gynecology and obstetrics, you do psychiatry, internal medicine, you do a couple of those, and then you have some electives, and you're going to be on call. My longest shift was 39 hours straight. That was really hard. And to feel like I didn't have a life, and to have my sleep disrupted like it never had been before in my life. I mean, you eventually get used to it, but it's hard. So as far as like rating medical school, like emotionally and physically, I'd say it's probably an 8, and residency was probably a 9 to 10, because it's like a marathon. It's a 4-year marathon. Internal medicine and surgery are the highest, like they're probably the busiest services. So I would get to work and there'd be 17 charts, meaning like there's 17 people that need to be admitted. I'd have to see who's the sickest, admit them to the ICU, and just like keep working down until I got through everyone. And sometimes you don't get through everyone. Sometimes you have to pass off charts to the next resident when they come on. So it's pretty hard. But that's not medical school, that is residency. So let me see did I answer your question enough, I hope?
So the next question.
Okay.
Hello?
Yes.
So the next question is like, first of all, like 39 hours is like 1 day and like 15 hours. Oh my God, that's so much. So
yep.
That's hands off to you to do that. Like, I'm not even trying to do that now.
Yeah. Oops. Surgeons do that all the time. So I would recommend not going into general surgery if you can't handle that. My little brother is actually an orthopedic trauma surgeon, and a lot of his surgeries, they just call and he can say like, do this or that, and the surgery will be tomorrow. But in general surgery, a lot of those are like emergencies, and also like, pulmonary critical care. That is going to be a really long shift. Usually their shifts are like 24 hours. So yeah.
Okay, for the next question, what was your most memorable experience throughout your medical school? Most memorable experience?
There are several, but like the one that just popped out as soon as you said that was, I had a little girl who had transverse myelitis. So she had a lesion on her spine, which rendered her paralyzed, basically from, I guess, the chest down, and, partially paralyzed in her arms. And I remember going in and seeing her smiling face every morning and just thinking how awesome of an attitude this little girl had, despite losing her ability to walk and her ability to do most things for herself on her own. She was 7. And it was really, transcending experience for me, because it really made me grateful for my health. It really showed me that it's important to have, to be positive and have a good attitude in any of your circumstances. And I remember one day when she was actually able to move her finger for the first time and how excited she was for that. So I would say that was probably one of my most memorable experiences from medical school. Did I do research during my schooling, and am I doing research now as a practicing physician? So I did do research because I actually kind of intended to be a neonatologist. So I did neonatology research between my first and second year on chronic lung disease of the neonate. So I did do research for that. I do not do research now because it's not really my interest. I actually enjoy like bedside and education. So that's what I do. What was my first year of medical school like? Was I immediately thrown in the field with clinical work, or there's some lecture-based classes? So the first year of medical school is basically all lectures. They do have, like at our medical school, they did have us do like 6 sessions with an OBG, like, well, not an OB, like they just put me with an OBGYN, but they do like 6 sessions with the doctor. I think 4-hour sessions. So you can kind of have an idea of what you're going to be doing. But the main purpose of that is, the main purpose of shadowing is to do that. When I did my residency working with the medical students, they would have them spend a day with us. And there are actually people that quit medical school after like that first day of, like they're like, I don't think I'm cut out for this. So make sure you get your shadowing hours in and make sure this is really something you want to do, because it's a big commitment, both physically, time, and monetary. It's a big commitment to go into medicine. It's mostly lectures. So let's see, what kept me going through tough times during medical school? So what kept me going through tough times was my peers. I had a good group of friends, mostly people of color, like the Mexican students, the like my Taiwanese roommate, also some other Taiwanese friends. We all kind of just stuck together and, of course, reached out to others, but mainly like, we all have really similar backgrounds, socioeconomically, culturally. They kept me going. And also like all of us went on a trip to, I went to Kenya with one of my professors and a couple other students, and we did an HIV clinic with him. He goes every year. And then we also went to Peru on a medical trip. And that really kept me going because it showed me like what knowledge can do for others. So I think that's what kept me going during the tough times.
And the next question, there's one question like that's almost similar to that. That's why I'm asking. So as a woman of color in medicine, can you speak about some challenges that you have faced or seen through other people, and how did you manage to overcome them?
Okay, so as a woman of color, what did you say?
What are some challenges that you faced?
Go
Mhm.
ahead. Go ahead.
Oh, like what are some challenges that you faced and how did you overcome them?
So as a woman of color, I think the two main challenges I faced were microaggression towards me and also like lack of belief in myself. So when you grow up and all the doctors that you see are white, you tend to think that like, oh, you need to be white to be a doctor because white people are smart. And maybe Pacific Islanders are not that smart because we can't be doctors. And I remember I was working at a hospital in Hawaii, like during my last 2 years of college. I was working at a place called Kawehi Hospital. It's a little rural hospital. And I was studying, in between, because I was basically kind of like a CNA. I would help like, during like when they were doing procedures and stuff, but I also like checked in patients, kind of just did whatever they told me to do. And they brought in this new nurse and he was like a male in his 50s. And the doctor said like, oh, this is Kawehi. She's pre-med. And I'm not lying. This is what he said to me. He goes, oh, are you going to go to one of those obscure schools in the Caribbean? And I was like, what? I was so like taken aback because I've never had anyone, that was like the first time I ever like recognized that there, someone's microaggression towards me. And I asked him like, what do you mean? Like, why did you ask me that? I'm like, and I said, is it because I'm brown? Is it because I'm female? Like, and he's like, whoa, like, don't get upset about this. Like, I'm just asking. And I'm like, well, you didn't ask me if I was going to go to Harvard. You asked me if I'm going to go to an obscure school in the Caribbean. Like, what is that supposed to mean? And he kind of put it back on me. But so I called my friend who's he's Samoan, so he's Pacific Islander, and he was in law school. And I was like, hey, this is what happened to me today. Did I take it wrong? Like, did I overreact? And he said, no, there's nothing else. Like, there's no other reason he would have said that. He absolutely was like, being racist or whatever towards you. And so that was the first time I realized that people actually think that way about people when they, just by looking at them, that they, assume things about them. And I had to like fight against that as well as against my own feelings about myself. And I guess the way that I got through that was through my dad's help. When I was young, my step grandfather had ALS, otherwise known as Lou Gehrig's disease. So he, was starting to have to use a walker and went to a wheelchair and eventually lost the ability to breathe. And I used to help take care of him. And I told my dad, because this is what I've seen, right? I'm a little kid. I was 5. And I told him like, hey, Dad, I want to be a nurse when I grow up because I like taking care of people. And you know what my dad said? My dad said, you should be a doctor. Why don't you be a doctor? And I had never thought of that because I'm a girl, right? And when I see nurses, they're girls, and I see guys, they're doctors, especially here in Utah, because we lived in Utah after like we moved away from Hawaii. So he kind of planted that seed in me. And then as I grew, he kept, reminding me and believing in me, like when I got into the University of Utah, he's like, oh, their GPA just went up. Like their average GPA just went up by admitting you. And I remember thinking like, I don't think so. but my dad believed in me. So you always need to have someone in your corner. And sometimes you can be that person for others. Like, since I've gone through the process, I work with the Pacific Islander pre-health profession students and remind them that they are enough and that they, like to recognize imposter syndrome and to, if they ever don't believe in themselves, come talk to me and I'll build them back up. So I think it takes having a person to believe in you. And I also think it takes having thin skin. Like another example, I have like male white students who tell me like, oh, I didn't apply for that, for University of Utah because I'm white and I'm male. And that's implying that I got in because I'm brown and I'm female. I don't need to tell them what my board scores are. I don't need to tell them what my GPA is. I just need to have enough confidence in myself that I don't need to go there with them. If I'm feeling feisty, I might, but it's not my place to have to educate someone like that at every step of the way. If they want to learn more about diversity and anti-racism, et cetera, then, I'll put it back on them. So I don't know if that's the right way to approach it, but that's what I do. And just make sure that you have like a good support system like I did with my fellow students of color. Any other questions?
Yeah, I actually have a follow-up question to that. So like, as you mentioned, there was kind of like a lack of representation, especially for of people of color. Cause like, as you mentioned, there's like a lot, like predominantly you only see like white males becoming doctors and you're not really like used to like seeing people of color and especially women in that field. So like, other than your father, who was the figure of your role model, did you find any other inspiration in other role models that you saw that kind of like encouraged you to further chase your dream of becoming a doctor?
No, but once I was in medical school, yes, I had one of my interventional radiology attendings was Filipina, and she took me out to lunch one day and just had to talk with me and encourage me. But like, I do want to mention, when I worked at Kawehi Hospital, most of the people that worked at the hospital who were not a doctor or an administrator did not have a college degree. They were Pacific Islanders like me. And I remember one day I needed to study for my OChem test and I had like a 10-hour shift that day. And I was just like, I want to study for my OChem test. So I called up and I said, I'm not going to lie, I'm not sick and I've never called in sick before, but I really need to study for my organic chemistry test today. And if I could have these extra 10 hours to study instead of work, I'd really appreciate that. And you know what? They told me like, hey, we want you to succeed. So, Auntie Pua said she would work for you. Like they called me back saying like, Auntie Pua, like, so in Hawaii, everybody is auntie if they're older than you. She said, Auntie Pua said she would work for you. We want you to succeed. And so every time I've gone back to Hawaii, I go visit them because they believed in me. And that really meant a lot to me. I think, people of color in our communities, I think we tend to really love and support each other. So even though I didn't have like a mentor to look towards, I did have like people around me that loved and cared about me. So.
And from here, I just want to point out that even if you're struggling with organic chemistry, you can still get there because we have an example right here with our professional speaker. So it's okay if you guys are struggling with organic chemistry. I get it. It's really hard, but you know what? It's okay. It's all right.
I know, it was actually really fun. I actually really liked it. You start with this, you end up with this, what's everything in between. I think it's kind of fun as a puzzle. Like it, and like my math degree, I may not use it very much right now, but what did math teach me? It taught me how to solve problems. What does a doctor do? We solve problems. Someone starts with a symptom, they tell us what, and I like try to trace it back to like, what's the cause, right? So it's really cool. It's really cool. And you get to connect with people at the same time. And that's, once like when you were talking about what keeps me going, it's like connection, right? I've been blessed. I've been able to be there when people are dying. I have been there when babies are dying, and I've gotten to hold babies while they're dying and hold them until their mother gets there and connect with the mother as she, sees her baby in my arms. Like it's been like really, I would call it a really sacred experience to be in this profession. It's a blessing. So someone tells us now, like, what is a day in the life now? Okay, so a day in the life of my former job is I get to work at 6 or 7 in the morning, depending on if the person who's on overnight wants to sleep in. They'll usually text and say, don't come until 7. So we get to work, get pass off. So they hand off patients to you. So they tell you like, this is what's going on. This is what I expect. This is what I did. And so basically that's pass off of each patient. And then I look over vital signs and labs and look at all my x-rays and CT scans or whatever I have, whatever imaging is there. And then we do rounds. So rounds is when you go and see each patient, and we usually see like the sickest people first, then the discharges, and then everybody else who's not leaving that day. And then like the medical students and residents have gone around and seen all the patients already. So they do their presentation to me. They tell me like, this is what they're here for. This is what happened overnight, even though I already know. They don't know that I already know, but I do. And then they go over labs, and then they come up with an assessment and plan. Like, this is what I think is going on. I think it's caused by this, this, or this, like the top 3, like we call it a differential diagnosis. I think it's this, this, or this, and this is what I want to do. So that's their plan. And then we kind of educate and redirect if we need to about like what really needs to be done for the patient after I examine the patient. And we go and do that for everyone. And then throughout the rest of the day, we do admissions, meaning like, you know, the emergency room calls us and asks us to come and see a patient to see if we think they need to be admitted or not, if they can send them home. And then we admit them and we start our workup based upon what we think is going on with them and start treatment. So that is what a day in the life is of a hospitalist. And then a day in the life currently is I basically go to work and I see patients every 15 to 30 minutes. And then I come home. So it's pretty, I get to work. I mean, I get to go to sleep every night, which I like. It's not as like intense as being in the hospital, which I miss, but it's still fun and I still get to connect with people. So I enjoy that. So why medicine for me? I think because I've always loved science and I love helping people, and that's how you combine the two. And then what did the process of getting accepted into medical school look like for you? Is there anything you would have done differently? So let's see, I got accepted into medical school in 2004. Basically, I got accepted into a handful of schools and I just chose the one that I felt I would be most comfortable at and which one was at a good cost. So some schools are like $50,000, $60,000 a year. Mine was $17,000 a year. That's a no-brainer. My little brother got into Johns Hopkins, but chose not to go there because he got a full ride scholarship at Vanderbilt. So just kind of, you know, did he want to live in Tennessee? Like, you know, like Baltimore, I don't know, like, I don't know. He just went where he knew he'd get a good education for a good cost. So let's see. Is there anything, oh, so I just chose, yeah. Was there anything I would have done differently? I probably wouldn't have applied for so many schools, and I probably wouldn't have applied for schools in places that I had no interest in living in. Because, you know, when I'd go interview, I'd ask the medical students like, oh, what do you guys do for fun? Because, you know, you got to have a life outside of school. Medicine has a high suicide rate and rate of depression. And I think it's because we don't take care of ourselves enough because we're taking care of everyone else for hours on end. And there's not a lot of time left for you or your family. So you should go somewhere where you can see yourself living and enjoying. And so I love Utah because the great outdoors. I love being outdoors. There's skiing, there's hiking, there's biking, there's lakes. I really love being here. So this is a good match for me. Whereas, you know, somewhere else that doesn't have those types of things wouldn't be a good match for me. So what do you think about nurse practitioners in hospitals? I think well-trained nurse practitioners are amazing. We had a nurse practitioner on our unit who was in charge of sedations, but she could do everything and anything because she was a former pediatric ICU nurse. And to this day, I have yet to find anyone who matches the skills that she has. So I think nurse practitioners are very valuable in the hospital and actually allow like surgeons, especially like a lot of nurse practitioners work with surgeons. they allow surgeons to be in the OR more, and they can pay close attention to the needs of patients once they're out of surgery. So I think they're great. Let's see. If you want to become a pediatrician, how long does your residency period last? It's 3 years. Yeah, and it is not dependent on your medical school program. So yeah, becoming a pediatrician is a 3-year residency. And then if you want to be a specialist, like if you want to be a pediatric cardiologist, you do like pediatric residency first, and then you do the cardiology fellowship. So that would be another 3 years to be a pediatric cardiologist. Is it dependent on your medical school program? No, it's 3 years anywhere you go. How did I prepare for the MCAT? So I did not have a lot of money, or basically any money, when I was an undergrad. So I went to the library and used an MCAT prep book and just studied for like 12 hours a day when I was preparing for the MCAT. What I would recommend in preparing for the MCAT is to do lots of questions. So my roommate and best friend from medical school, who also went to the same residency as me, is from Taiwan. And she said in Taiwan that they actually teach you how to study. So I'm going to share with you what she taught me, because it was really valuable to me. Because she used to say like, oh, Kawehi, come over here and let's talk through this. And I'm like, no, I need to get it down first. And the way I get it down is I just read it over and over. And she's like, no, that's not how you study. In Taiwan, they teach you have to use different senses every time you learn material. So she said the first time you should read it. And so what I started doing was reading through lectures before I went to lecture, because I recognized that once a lecturer said something I didn't catch or I didn't understand, it's like I stopped listening. I was done. All the rest of the lecture was like in the hole, and I was just going to have to go figure it out on my own once I left. So I started reading the lecture beforehand, so that when I heard it, it wasn't the first time I had ever heard of it. And it really doesn't take that long to read through lectures beforehand. You can just like skim it. So I would read it, I would hear it. And then she said, next time you have to use your hand. It has to be like tactile. So she said, like, you outline or like, write things down, right? Take notes, or like at least like highlight. So that's a different way of processing the information. And then lastly, you talk through it with someone. So, study groups talking about something you're learning, like you're teaching. And that really cements the information in your brain. And then lastly, review the information. She taught me like more than 48 hours after, but before 2 weeks, and that it gets into your long-term memory. Have I verified if that's true? No, but it sure worked for me. And then things that I, because like, certain things you can just figure out by thinking through them, like certain physiological things, like, okay, if you know this, then you can like figure it out. But other things they're just facts that you have to memorize. So those facts, I would speak into my phone, I'd record them, and then I would run, like when I'd go running or hiking, whatever, I would listen to them. And honestly, when I was taking my board exam, I could remember like the rock that I passed when I remember, like when I heard that fact, and I boom, got the question right. So I would recommend studying in a similar way, and especially doing questions like for the MCAT and also for your board exams once you have to take them. I purchased like a 1,500 question bank, and I just saw like how many days I wanted to finish those questions over and divided it by that many days. And so I was doing like a certain amount of questions a day. Those questions actually help you to understand like what they're after and how to think through the question. And so during my board exams, I actually had a lot of questions that I'd already seen before. And I already knew that, oh, they're trying to trick me. I know it's not that. It's actually this is what they're after. So always do questions, because it forces you to think more deeply about information. It's not just like recalling a fact, but being able to like think through that information and understand on a deeper level. So let's see. So that's how I prepared for my MCAT and my boards. Is it hard to not bring home a pediatric loss to your family? Absolutely. That's why we have mentors. So I'll tell you about the time that baby died, like the baby I was talking about that I was holding before the mom. This was a baby that was less than 3 kilos who had a congenital heart defect, and we were trying to grow this baby using TPN. So it's like IV proteins and fats and electrolytes and glucose through an IV to help this baby get the nutrition the baby needed, because he couldn't eat because his heart wasn't working. So in a baby, having a heart that's not diseased is important, because eating is like the biggest form of exercise for a baby. And if your heart isn't working well, you actually like lose weight or can't even tolerate eating. So this baby was on IV nutrition. And I came in the morning to get sign out, and the resident from overnight said like, oh, this baby's not doing well. We think they're duct closed and he's not going to last much longer. We've called the mom. And I was like, oh my gosh. And I went to go see the baby. The labs, like we did blood gases, were not looking good. Baby's coming acidotic. And so we knew he wasn't going to make it long. So we again called the mom, and she was on her way from like an hour and a half away, because we were at a referral hospital. And she was trying to pick up her kids from school so that they could come say goodbye to their baby sibling. And actually her husband wasn't going to come with her because he couldn't handle it. And so I remember the baby was dying, and my attending was trying to push fluids to try to keep him alive for a little bit longer. And she said, that's it. You're not dying by yourself. And she like ripped open the incubator and she just picked him up and held him. And then she gave him to me and said, you're going to hold this baby until his mom gets here. It's probably one of the hardest things I've ever had to do. Sorry. And after that happened, the attending went and took a break, but the fellow needed me to finish rounds with her, because I'm the one that gathered all the information in the morning from every baby. You have to get all the vitals, the urine output, the labs, and all of that. And she wanted me to keep doing rounds. And I was just increasingly becoming more upset, because I just saw a baby die, and I just saw a mom grieving. And I was having a hard time voicing that, because in medicine, you're supposed to just be tough and you're supposed to just keep going. But she finally said, is there something wrong? And I was like, yeah, my baby just died. This is not important to me to be giving you numbers right now. She's like, do you need to take a break? And I'm like, yeah, I do. And so I went to go sit down, and my attending came to me, and I thought I was in trouble. But she actually said, we had a good conversation about what it's like to lose a patient so young. And she took me out to dinner that night, and I'll never forget it, how much she cared about me, and was able to help me through that, because it was really hard. It's still hard today. Obviously, I'm crying talking about it, but it's always hard to lose a child. But it's important to be there. It's important to be there for families who have to experience loss and grief. And it's important to be there for your colleagues too. And it's okay to cry. It's okay to talk about it, because we're human and we have emotions. And I think that's what makes medicine beautiful, is being able to be there for each other.
Before we go on, I just want to honestly just thank you so much for sharing that experience, because I got a little teary-eyed when you talked about it too, because it's just, I guess you can't really physically put yourself emotionally there until you really experienced it, and it really hits you like a brick of stones. It's just like there's so much happening at once, and it's like you're forced to be in a position where you have to be, the person in charge, but at the same time you're human too. So obviously it's kind of like you're trying to balance the professionals aspect with the human aspect, which is extremely difficult. So I just really want to appreciate you for showing it, even in medicine, right? It's we're still in a very sensitive era between life and death. Even though you probably have experienced patients just over the years, it grows on you, but obviously you're not numb to it. It still affects you a lot. And I just really want to appreciate you for just expressing that out loud for the students here. So thank you so much for that.
Thank you. Thanks, guys. Does medical school somewhat prepare you to break bad news to a family member? Yeah, they do. They do give you classes on that. It's really hard.
but it's important. And I think it's really important to show compassion and not just to be a robot. Yeah, let's see. So yeah, they do teach you a little bit about that. What's my favorite memory of being in healthcare? Oh, I don't know. I have so many. That was probably one of them. Even though it was like the hardest, I just really appreciated getting to be there. Because it is really sacred time for people. Because you know, you're there on the worst day of some people's lives. So I think that's what I appreciate the most about medicine. You know, just recently I had to tell someone they had leukemia. And it was a complete shock because that's not what they came in for. Came in because he thought he had high blood pressure and some other things. And so we did some labs and I'm like, oh my gosh, you have leukemia. I don't know why I just laughed. I think it's a nervous response, but it's really hard, but you learn from the compassionate physicians that you work with, like how to be there for people. Especially when I was on my cancer rotation. So like during my internal medicine, I was at the Huntsman Cancer Institute, which is right next to the University of Utah. It's world class. And it was, wow, it was hard. My very first medicine patient died 11 days after his first symptoms of pancreatic cancer. And his family was just in such deep grief. And it was amazing to watch my attending physicians be there for people they just met. Yeah, going into medicine I think it's a calling. It's a really good profession. Let's see. What is something you are challenging yourself professionally on right now? So right now, I'm challenging myself by doing outpatient medicine. It's completely different from inpatient medicine. So I'm relearning a lot of musculoskeletal things that I didn't know, and also like women's health. Because I am female, I tend to attract a lot of female patients with obstetric and gynecologic complaints, which is not really focused on in internal medicine residency. You see that more in family medicine and in OBGYN. So it's been a big challenge for me to like learn this stuff that's outside of my specialty, but it's been really fun because, you know, like when I was a peds hospitalist, I kind of felt like, you know, I've basically seen everything. Like I've basically seen everything I can see. I saw a girl's brain herniate right in front of my face. Like, I mean, she somehow got into our unit without going through the ER because the mom didn't know where she was supposed to go. And she started having a seizure. And then when I checked her pupils, one of them was blown, which means your brain is starting to herniate down through your skull, the foramen magnum, which is usually like going to kill you. But we just put her head up and put her to the CT scan, intubated her and sent her off. And she was in brain surgery within 2 hours later. So that's the kind of stuff that you're like, I can't believe I just saw that. And that girl's still alive. And now like where I'm at, I have like complaints that are like, I have no idea. Like someone came in with a chief complaint of yellow hands. Like what is that? I have no idea what that is. So like, it's very different from what I used to do. So it's been challenging in that way. Let's see, any other questions or are we done?
Yes, there is actually another question, but this is more fun-based. So say you did not pursue medicine, what other career choice was like back behind it or like what you would have pursued?
Oh man, bass player in a reggae band. No. Paramedic, firefighter were some of mine, but actually a pilot were some of the things I thought of. But actually, I'll just say this: when I was in a residency, when I was on my sports medicine rotation, they had me rotate with an occupational therapist who works with children. I went to this school where she worked, and they had the school set up where it was set up like a house. So there's like a kitchen and like all like, you know, a bedroom and a bathroom. Like it was just like set up like it would be a house. And the occupational therapists were working with children with disabilities. Some of them were in wheelchairs. Some of them had like issues with their hands not being able, like not working well. And so they actually adapted their activities of daily living, like, put something on the oven so that they could grab, like, so they could use what they could of their hands to like pull the oven open and put something in, and just to see their faces when they could do something on their own. I'm like, whoa, I totally could have loved this job. So just a pitch for occupational therapy. It's a really cool field. And I think I would have loved it if I didn't do medicine. Yeah.
Okay, so we do have another question that's more referring to your previous occupation. So as you mentioned before, it was kind of like a crazy schedule. You mentioned it was like 84 hours per week and then the next week off. So like in that state, how did you come to the acknowledgement that you were experiencing burnout and you had to just stop and you couldn't continue? Because I feel like a lot of pre-med students, we tend to just like focus on go, go, go. And it's never like focusing on our own health, like as you mentioned before. So how were you able to take a step back and just realize that you needed to like change something?
A lot of it was with my daughter. So I'm a single mom, and my after my divorce, we were supposed to have 50-50 custody, but my daughter's dad wasn't showing up, like just randomly, just didn't show up. And so I'd have to bring her to the hospital and put her in my call room because I don't want to leave her with anyone. There are a lot of people that offered, but I didn't feel comfortable doing that just because of like concerns with like sexual abuse. I don't know if you know, but like the rate of sexual abuse in females is like 1 in 4. So I didn't feel comfortable leaving her at anyone's house. So I would bring her to work with me. And I realized like, this is not good for her. And I'm not really enjoying working nights anymore. I started noticing that I was becoming like more angry at night that I had to be there, even though I loved my job during the day. And so I think just recognizing those feelings in myself, like, I don't enjoy this job anymore when I'm working nights, kind of led me to switch schedules. Yeah.
Yeah, thank you so much for sharing that. It was very personal. So like I really applaud you for just letting go and just like showing it with no filter. So thank you so much for just like, sharing your story with us and just like having that personal connection. So thank you so much.
No worries. So what advice would I give to undergrads that want to pursue something in medical field but not sure about it? I would say that's what shadowing is for. I would make sure you go and shadow a couple of different, so like I had a student shadow me, but I also set up for her to go shadow like the surgeons and some others. And so she's like, yeah, I really like this, but I definitely don't like being in the OR. So I would try like multiple different specialties before you decide it's not for you, because medicine is so broad. There's so many different things you can do. Like I said, my little brother's trauma ortho and he absolutely loves it, but he would have hated doing what I'm doing. He could not wait to get rid of his stethoscope at the end of residency. It's like, I just want to take care of bones. So I would say get a broad range of exposure by shadowing. And talk to someone who's in medicine, and but not everybody's perspective is the same. I've been on a medical mission trip to Kenya several years ago. Was it life-changing? Oh, absolutely. It was life-changing. It was, like I said, I worked in an HIV clinic, and one of the babies we took care of was only 5 days old, and the baby's parents had died and the grandparents had died of AIDS. So the baby was being cared for by the great grandma. If that's not life-changing, I don't know what is. Seeing what people like, we need to expand access to a lot of things for people in medicine. And so even though I'm not working in global medicine right now, actually I went on a trip I did a medical trip to Fiji a few years ago too, just because I'm a Pacific Islander. There's a lot of things that we have that we take for granted. And being able to provide that for other people is life-changing. What would be the path you would take to work towards becoming a cardiac surgery PA? Also for people going to pre-health, would becoming a CNA, are there any reputable schools you can recommend? So I would become a CNA as fast as possible. In fact, I was a CNA. I got mine in 2 weeks. It's mostly like on the job training, honestly. So I would just become a CNA as fast as possible. And to become a cardiac surgery PA, you need lots of hours, I think. I would talk to a pre-health professions advisor, because medical school is different from PA school, but from what I understood, PA school requires a lot of
clinical exposure hours. So most people are in some, and it's because you don't do residency, right? It's like 2 years, whereas medical school is 4 years plus another 3 to 4 to 7, depending on whatever residency you do. So you need to get the on-the-job experience prior to PA school. And so that's either being a nurse or, you know, something else in the medical field, paramedic, I don't know, but you need to get lots of hours to work towards PA school. And then to become a cardiac surgery PA, I would say be an OR tech maybe before. I think that would be really helpful, but I don't know. I'm not a PA, so I'm not quite sure. What were some methods you have used when dealing with failure, feelings of imposter syndrome? So luckily I didn't fail while I was in medical school, but there was, you know, a learning period during my first year at BYU where I like wasn't going to school or doing my work because I didn't have to do that in high school and I got straight A's. So I did do poorly in some classes, and you just have to realize that everybody is human and that we all fail, but that you get up and try again. And that's what most medical schools are looking for. Like if you did fail or if you did do poorly, what did you do after that? What was your next step? Was it to give up or was it to do better? And so I would like take into account like growth mindset. I think that's been studied by Brene Brown, but basically it's not like I'm a failure. It's I didn't do well. I will do better now, you know, instead of just like I'm a failure. So just use that growth mindset. Feelings of imposter syndrome. I surrounded myself by people who looked like me, who felt like me, who, you know, worked towards a common goal. Like I feel like at schools like BYU, where everybody's like type A in the top of their class, there's more like competition and trying to step over you. Whereas a place like BYU-Hawaii, it's all about like nurturing and encouraging each other. And I felt that much more at BYU-Hawaii where I was. So all of us that were people of color that were studying for the MCAT together, we all supported each other. We weren't like trying to do better than each other. And I think that's the point, right? The only person you need to do better than is yourself. You don't need to prove yourself to anyone else. You don't need to do better than them. You're not going to ever be happy if you always have to do better than others, because you will always have someone doing better than you. But you can become better yourself each day. Are those medical trips provided by your medical school or professors? So we had to raise money for them, but we just did like, you know, because my brother played football at the University of Utah, I was able to get some items for auction at this like dinner that we put on to raise money. So yeah, we had to raise money, and that's why, like, to me originally that was like, oh, that's unreachable for me. I don't have $3,000 or whatever it costs to go. But when my fellow students are like, oh no, we don't either, we're going to raise money and this is what we're going to do, like, oh, I jumped right on board. Like sometimes I feel like those things feel unattainable to us, but you can always find a way to do things that you want to do, even if it's loans. Part of my trip to Kenya was paid for by my student loans, and I still graduated with way less loans than a lot of my classmates. Which CNA program would I recommend? I would just recommend anything you can find that will get it done fast, because honestly, you're not looking for a good education when you get a CNA. You're just looking for a certificate. I don't know if that sounds bad, but like I said, mine was only like 2 weeks and I found it online. So I don't know what CNA program I'd recommend. Just anything you can find online. If anyone else can answer that question, because I don't know what state you're in, Shania. If anyone else could help answer that question, that'd be great. I just found something online. Any other questions? 6:05, so we've been going for like an hour. How long does this usually last?
We usually have the presentation going on for like, so the professor speaks about like their experience for like an hour, and then we leave like the 30-minute for the Q&A session. But like we've been really effective with the session today, so we kind of incorporated 2 of them into one, because you did essentially talk about your story through the source of the questions. So we were able to get all that covered within like a short amount of time, which is extremely effective.
Okay, well, thanks. I don't think I could talk about myself for an hour, but I guess I just did.
Yeah, actually, we do have one final last question before we go into a wrap-up presentation. So the last one is I'm not sure if you actually meant answered the question already, but why specifically did you pick like internal medicine over like any other medical specialty that you could have gone into?
Well, I didn't just pick internal medicine. I picked internal medicine and pediatrics. And I love internal medicine because like looking across a lot of the specialties, it's like so specific, like only the heart, only the cardiovascular system, or only like ear, nose, and throat. That sounds so bad for people that love that because, they know a lot about their specialties. So like, this is the way that some people put it. So like for internal medicine, you can know a little about a lot, and then specialists know a lot about a little. So I just love internal medicine because it's everything you learn in medical school, right? Like cardiac, respiratory, rheumatologic, musculoskeletal, endocrine, just so cool and so many different things that I just couldn't see myself not doing it. So that's why I picked it, just because it's cool. It's like everything. Let's see.
Yeah, that's honestly a good way to put about it, because when we have other speakers come in, like they were from internal medicine specialties, they kind of scare me off a little bit because they're like, yeah, you have to know like almost everything because internal medicine is everything. But at the same time, that's like that kind of scares me off because it's like, oh God, like I really need to know everything about everything. Like that mentality is just crazy to me. But just hearing from you talk about it, it sounds more fun in the sense that you have to like, there's a little bit about everything, but it's not like a lot. Like you have the bases covered in a sense.
Yeah. And then, that's what Up to Date is for. So Up to Date is this like website that almost every doctor subscribes to, or like every place I've worked for has it. So it's like, yeah, I know that it's probably this and this, but it's like, what's the first thing that you do for workup? Because you want to make sure that this test that you're ordering are the right ones or the most high yield things. And you're not just like blatantly ordering a bunch of stuff. So you can hurry and like quickly check because your knowledge is like pretty good base, but like maybe you just need a little bit more, and you can quickly look up those things online. Whereas like my forebears had to like go to the medical library. One of my attendings in residency he's Indian, did his residency in the UK. And he told me that like he was on call for over 50 hours, like this whole weekend. He's like, I went there on Friday night and I didn't leave till Monday. And he's like, I admitted like 50 something patients. And he's like, I didn't even know my name at the end of that back in the day. And like, he didn't have computers to like look up the doses for things. He didn't have computers to look up like, what's the next step when someone has this symptom? Like he didn't have any of that. And I was like, man, I have it so easy compared to those guys. Back in the day, it was brutal. They've made like work restriction hours now that you can't work longer than 30 hours straight or something like that. Anything else?
Okay, so that was actually our last question.
Yep.
So what we're gonna do right now is kind of wrap up the presentation. So when again, Dr. Hu, so thank you so much for coming and talking to us and just like sharing your medical journey and just answering all the questions that we had, and just like showing more of like the emotional and compassionate side about medicine, because usually we get more like clinical stuff, so it's like a rarity and a treat for us to really like delve into more of like the human side of like what medicine is really about. So honestly, I just want to thank you so much for just bringing that to light and kind of inspiring us in that way. So what we're going to do right now is actually enter the wrap-up presentation. So for this part, Dr. Wu, you don't need to stay for this because it's just like administrative stuff. So just like as you saw in the beginning with the starter presentation. So if you need to go, because I know you're on a busy schedule, you may leave the meeting if you need to.
Yeah, sure. There's someone that's asking me a question, so I'm just going to hurry and answer, and then I'll go. But
Yeah.
Thank you very much. Thanks for the opportunity, and good luck to all of you.
Yeah,
You'll
thank
be
you so
great.
much again.
And support each other. Okay, bye.
Okay, so now the session is well, the presentation part is over. So what we're gonna do is transition into the wrap-up presentation. So this is the part when we're going to introduce you guys on how to get your shadowing sessions verified, as well as other administrative stuff that you might have missed in the beginning, including like applications to team member forms and just any other general questions that you may have. So stay tuned for the little bit of like 10 more minutes so we can explain more of the other stuff coming up. So Christian, you can go ahead, and Matt, if you can share your screen again for the wrap-up.
Yeah. So, well, it was a very informative presentation, and I think we all learned a lot from our speaker. So, considering this, we would like to encourage everyone to reflect on the section today. What brought you to this section today? What are the 3 major takeaways you got? And what do you want to learn more about? The writing or reflection is not required. However, we encourage you to submit it to our website for publication, for recognition of your hard work, and to enhance the future applications. I would like to mention once again that PH Shadowing is launching a research program that will allow students to connect with PALs as they conduct research in a philanthropy of topics, fields, and locations. This program is 100% remote, which means you have the power to connect with anyone. This is an 8-week program. For more information, please fill out the interest form sent in the chat below, and we will get back to you as soon as possible. Furthermore, PHS is hosting a bingo board social media event for July, where you will be able to fill up a bingo board with each board having a specified dollar amount. To participate, all you need to do is post on your social media platforms and get a group of friends to help you fill out the board. Additionally, we have partnered with Krispy Kreme. With a donation of $10, you will be able to receive a dozen of donuts, while also helping us at PHS. More information and instructions can be found by clicking the link sent in the chat. Lastly, it is a perfect time. Okay. Lastly, it is a perfect time to exercise outdoors with PHS new pledge drive event. For this event, you will essentially be able to work out and help raise money for an excellent and healthy cause. For every $5 you donate, you will be required to exercise for $1. For more information, please visit the website underneath the blog. If you want to learn more about the PHS shadowing and get involved in our program, we would encourage to visit our website. You can become an asynchronous volunteer to get certified hours, professional nominations, graphic design, and social media promotion. We are also accepting team member applications if you want to take on a more active role in PHS, lead programs, and initiatives to be part of us. Once again, we humbly ask that if you are financially able to donate, that you please consider sending a few dollars to us through Venmo or PayPal. It costs a lot to keep the program running, and plus it's free for all. So if you are someone who can afford, then please do. Please support those who cannot by donating to our organization so everyone can continue to get the education they deserve. Otherwise, we simply ask you to spread the word about PHS to reach as many students as possible. Now for the part that we all have been waiting for, earning a digital certificate for the virtual shadowing hour for this section. So first, go onto the website and find out the professional course pages. Next, you can take our quick 10 minutes multiple choice question quiz based on the content from the section today. You will have 30 minutes per attempt to earn 70% or higher to get your certificate. We know that sometimes technology can be difficult. For this reason, we allowed 2 attempts to take the assessment. But if you run into any difficulties, please contact us. To ensure that our website does not crash from a high influx of students, we recommend waiting 30 minutes to an hour after the section to take the quiz, which will be open indefinitely. Once you have passed, you can click the Finish Course button at the bottom of the professionals page and download your certificate verifying your virtual shadowing hours. If you have missed a part of this, section, or want to go back and view other sections to earn more certificates with the verified virtual shadowing hours, we can go to our YouTube channel and watch the previous recordings. You can also find them via the professional pages on our website. Take the pro-shadowing assessments for these as well. Be sure to follow us on social media or subscribe to our email list for the latest updates on the oncoming events and sections. Thank you for joining us all, and please stick around if you have questions, and myself and our team members will be happy to answer them. This sharing section is officially over, and I invite everyone to log off. Thank you and have a nice day. Mhm.
If anyone has any questions for any of the board members, you can either unmute yourself or type it in the chat, and we will try our best to answer whatever question you may have. So we have one saying, where do you find the quiz? So essentially what you're gonna do is go into the pre-health shadowing website. So that'll be prehealthshadowing.com. And then under the shadowing list, there should be like upcoming sessions. So what you're gonna do there is that you're gonna find the professional's name, which was Dr. Au, Dr. AU. So then you're gonna click on that one, and then you're just gonna click start course. And then from there on, you should be able to see the presentation as well as the quiz that's kind of used to verify your shadowing hours. So I hope that answers your question, Christopher. Cool. Okay, good. All right. So we have another question to ask about what positions are available to join your team. So for this one, we did send, I'm going to share my screen again. So it was over here, I believe. So the positions that are still available are, let's go back. Oh, they removed it. Hold on a second. It's the other one. One moment, please.
I think I can put the link in the chat.
Okay, yeah. So essentially, if you click on the link, you might it comes up to like a Google form sheet, and it should give you a list of like the positions that are still open as of now, because we're constantly updating it with new members. So if you are curious about like what positions are still available and like what options you might have to choose from, you could just click on the link and hopefully it'll take you to the website. Yep, no problem.
Is the one I sent a link the right one, Susan?
Let's check. Hold on a second. Let me click on it. And also, Matt, can you stop the recording real quick? Yes, that is the right one. Okay, so does anyone else have any other questions? Nope. Well, okay, I guess we don't have a question then.